are here in the cardiac rehab area at Baptist Heart. Joining us is Dr. Daniel Kelly. Thank you for being here today.
No problem.
And
Happy
you are
to
a
be
cardiologist here.
Yes.
Now, a lot of people might have some New Year's resolutions to exercise and get healthy. And of course, this helps your heart. So how does exercise help your heart?
Absolutely. It helps your heart in a lot of ways. It increases cardiac conditioning, and it helps increase weight loss. It can lower your levels of cholesterol, lower circulating glucose, reduce your chances of diabetes. All of these things can go together to actually reduce your overall mortality as up as 20–30%. Subjectively, you just feel better.
A lot of benefits, not just one or two, a whole list of things that can
lot.
Yeah. Well, so what are some exercises people should be doing for their heart?
For your heart specifically, the most effective exercises are those that just increase your resting heart rate, and doing so for an extended period of time. Examples would be just starting with regular walking, jogging, swimming, pretty much all the typical aerobic activities.
Is there a certain time length people should be doing these exercises for?
There are general recommendations. The American Heart Association recommends for moderate intensity exercise doing at least 150 minutes a week. So you can break that up however you like. For vigorous activities such as actually jogging or intense cycling, at least 75 minutes a week.
Okay, and now we do have a lot of fitness levels. People might be just starting out or been exercising for a while. So how can you gauge the progress for these exercises?
I think the first way to gauge progress is just to actually monitor your consistency. If you actually show up and do the work, the results are going to come with it. The second way I would say is just, number one, determine your goals. If your goal is just to exercise a certain amount of time, that's easy to track. If it's weight loss, track your weights. If you want to be able to run a certain distance, track the distance. So I think the main thing is just writing down your results, whatever your goals may be, so you can actually keep up with them.
And once you see the results, you can keep going.
Absolutely.
With it.
It's encouraging. It makes you want to do more.
Yeah, and so what if someone is sedentary, hasn't had much fitness in their life? What should they do to get started?
Yes.
So they can stick with it too.
Absolutely. You don't want to get too burned out up front. I think the best way is just to ease into it. And so if you're someone who has been fairly sedentary, I would start with something easy like just light walking, and that's what I typically recommend my patients do. Monitor your symptoms, see how you feel, and just slowly escalate. And if you're someone who does have a lot of pre-existing conditions, other medical problems, it's always reasonable to discuss this with your physician before starting.
And people don't think about walking having a lot of benefits, but it really does helps you get that foot towards exercising.
It gets you off the couch. And you know, in all the research that the American Heart Association and other organizations have done, they've really not found any lower limit that shows benefit. And so just doing anything is going to help you.
Just walking around your street out in front of your house or something.
Just getting out and just getting some walking done.
So what should people do to develop consistent habits to make sure they keep on exercising?
I think the number one thing is with consistency is just accountability. And whether that be someone, your spouse or a family member, getting them to go out and do it with you, or a group of friends, but having someone to exercise with is going to keep you out there a lot more likely than doing it by yourself. And the other one just goes back to what we discussed earlier, is tracking your results. You're going to be a lot more consistent if you are keeping up with your goals and your progress. You're going to be encouraged and more likely to continue.
Now we are here in the cardiac rehab area, surrounded by exercise equipment. So what do you guys offer here at Baptist Heart for people to exercise and get on this path to healthy?
Absolutely. So here in the Cardiac Rehab Center, it's an excellent program. We utilize it for people with certain cardiac conditions, a number of them, such as heart failure, coronary disease, and it's a supervised setting with plenty of equipment, with medical professionals, to help people recover and to help people begin to build cardiovascular health. And for most conditions, insurance actually will cover it, so it's a win-win.
No excuses.
No excuses.
Come on in here.
Yes.
Now, we've talked a lot about exercising, but what role does diet play in heart health too?
Yes, the less fun part of cardiovascular health. But it works hand in hand with exercise. From a cardiac perspective in particular, we typically recommend starting with a Mediterranean-style diet, and maybe not having to do that diet alone, but taking pieces from it, more healthy fruits and vegetables, just healthier foods with lean meats, fish, less red meat, less processed foods. And then for people who deal with hypertension, high blood pressure, or heart failure, trying to cut out salt if possible, following a DASH type diet, so low sodium diet.
So what kind of health benefits will people see once they start following these diet guidelines?
Yes, a lot of the similar benefits from exercise, but you can definitely see some weight loss. You can see lower blood pressure, less risk of diabetes, high cholesterol, and just lower risk of cardiovascular disease overall.
Well, thank you so much for being here with us today and sharing these useful tips, because we all need to get healthy this new year.
For sure, absolutely.